Hi, I'm Dr. Raj, and today's theme is evaluation of dysphagia. Are you ready to go beyond the pearls? Let's get that vignette. We have a 78-year-old man is evaluated for dysphagia. Stop right there. Is age important when we talk about our differential dysphagia? You know the answer. It's yes. What goes high on my differential as we get older in age? Ooh, esophageal carcinoma. And how many flavors does that come in? 2. Squamous cell carcinoma, and what are the risk factors for those? Drinking and smoking and drinking. Or it could be adenocarcinoma, and what is the big risk factor for that? Why did you read my mind? Gastroesophageal reflux disease. But let's get some more information about what's going on. The symptoms of dysphagia began 2 weeks ago. When he eats, he starts coughing after the first bite of food and occasionally has this nasal regurgitation. On exam, patient's normal tense of non-tachy, non-tachypnic. There's some left-sided weakness on both the upper and lower extremities. Which of the following is the most appropriate diagnostic test to evaluate this patient's dysphagia? So as you're looking at the answer choices, why did Dr. Raj pick this question? Is because many people feel anytime they say the word dysphagia, there's only one test order, and that's always going to be what you thought about. Barium swallow. And the answer is that is not the correct answer, because when I take a step back, let me throw this question at you. How many broad types of dysphagia are there? And the answer is 2. Are you a little shocked by that? What are those 2 types of dysphagia? There's always going to be the transfer dysphagia and transport. So the question becomes, what type of dysphagia does this patient have? And the answer is transfer. So it's not going to be a barium swallow. I don't think manometry will be the answer just yet in this patient. And you know, classically on board questions, what types of dysphagia love to have manometry? I heard you. I'm with you. Achalasia, outstanding. Maybe undiagnosed scleroderma, way to go. And one more out there. What did you say? Yes. Diffuse esophageal spasm. Oh, you guys are just way too good. But I wouldn't put that as the next best test to order. Upper endoscopy, don't get me wrong. You get some alarm symptoms with dysphagia, you're putting that scope in there. Would I order it right away in this vignette? The way that he's eating the food and he's getting some nasal regurgitation with stroke-like symptoms? Probably not. The answer is going to be what? D, video fluoroscopy. So, before I explain myself, let's talk about these 2 broad categories of dysphagia. So transfer dysphagia is more common than you think. Who gets it? People in this vignette. People who had stroke. People who have neuromuscular diseases. People with multiple sclerosis, ALS. Why? It's because when you have that horrible stroke, what do we worry about? Can you protect the airway? Can you eat? Can you swallow? Because if you can't do these things, what might you get? A feeding tube. And that's why in the hospital, it's so important that speech therapy, physical therapy evaluates our patients to see about eating. So when you have trouble transferring the food back there, this is not a test where you need to have a barium swallow. You need to evaluate that upper airway. Transport dysphagia, though a very common question on board exams, this is going to be the process of getting food from the esophagus down into the stomach. Things like esophageal carcinoma, things like achalasia. And that's where you could think about doing that traditional barium swallow that we think about. So, the answer is, how do you approach a board question? How do you approach a patient? I do agree, barium swallow first, but remember how many types are there? There's a modified barium swallow when we talk about transfer, and there's a traditional barium swallow when we talk about transport. Then after that, if necessary, think about an EGD, and in certain cases, don't forget our good friend, manometry. And when we talk about terminology, if I were to say, what is a barium swallow? Another name for that would be an esophagram. When we talk about the modified barium swallow, other names could be video fluoroscopic swallowing examinations. And it's a procedure that you need a radiologist and our good friends from speech therapy. I hope this summarized how do you approach a patient with dysphagia. If you like this case, go to my website, beyondthepearls.net. And check out my book series, What a Surprise. Title is Beyond the Pearls. I'll see you next time.